Outstanding essay in Tablet magazine written by Ashley Hernandez, talking about why doctors in Germany in the 1930s became Nazis. And the whole public health institution and the medical institution in Germany in the 1930s promoted the Nazi propaganda and messaging construed for how to manage public health. And at times of famine, they decided that if this whole society couldn't support food for everybody, that they would remove the people who needed the food the least, meaning helpless, handicapped, disabled young people, frail, elderly, so on, who were expendable when the food had to go around to the people who needed it, whatever that meant, you know. And they operationalized rational considerations without human moral considerations. And public health has the risk of doing that. When you have so much day in, day out propaganda that people believe it because they're bombarded with it through all of the major media, that they accept these messages and they act on those messages instead of the truth, the reality of life and science and medicine. So doctors, I think, are just as frightened, just as anxious as everybody else, and maybe more so, because they've invested so much time and effort into getting their careers going. They feel they have more to risk even than just, you know, Joe Plumber or somebody else. So they went into their field because of stature and considerations of accomplishment and doing well for, they feel that they are at higher risk in some intangible way, I think. And so they're more likely to toe the line, and those lines have been enforced on them through the corruption of all the medical agencies, the medical review boards of all the states, the pharmacy review boards have all pushed a top-down message coming from FDA, CDC, WHO.